Welcome. So I would like to introduce my topic today and investigate the correlation between oral health and comorbidities. My name is Caroline. I'm a PhD student and dentist. My supervisors are Jolt Lonai, Beata Kermi, and Eniko Zappo. My SMS is Patrona. And my mission is to reduce the number of comorbidities which are associated with oral lesions. My vision is to educate the population on the importance of oral health and the impact which it has on our general health. And I have two goals. My first goal is to investigate the prevalence of oral bacteria in cardiovascular samples. My second goal is to investigate the effect of endodontic treatment on inflammatory biomarkers. And this is systematic review and meta-analysis. So why is my topic important? Because cardiovascular disease is responsible for the loss of 18 million lives each year. Periodontitis, which affects up to 50% of the population, is associated with increased risk of cardiovascular disease, which includes atherosclerosis, hypertension, endocarditis, heart attack. And the more severe the periodontitis, the higher the risk. There's no clear data which exists regarding the exact mechanism of oral bacteria in the development of CVD. My aim is to determine the prevalence and the risk factor of oral bacteria in cardiovascular samples of adults with cardiovascular disease. And my first clinical question: what is the prevalence of oral bacteria in cardiovascular samples of adults with cardiovascular disease? So my population is adults with cardiovascular disease, and we would like to detect oral bacteria in the cardiovascular sample by PCR and culturing methods. And my hypothesis is that in adults, CVD oral pathogens colonize in the cardiovascular lesions. Okay, and my second clinical question: does the bacterial profile in the cardiovascular samples differ in adults with and without periodontal disease? So our population is adults with cardiovascular disease, with and without periodontitis, and we're checking the oral bacteria in the cardiovascular sample by PCR and culturing methods. And our hypothesis: the bacterial profile in cardiovascular samples of adults with periodontal disease differs. And my final clinical question: is the presence of oral bacteria in oral samples a risk for the colonization of oral pathogens in cardiovascular lesions? And our population is adults with cardiovascular disease. We have a positive or negative bacterial sample, and we would like to check the oral bacteria in the cardiovascular sample by PCR and culturing methods. Our hypothesis is that oral pathogens found in periodontal pockets increase the odds of detecting oral microorganisms in cardiovascular samples. And our clinical implication is to improve interprofessional collaboration amongst healthcare professionals and to prevent CVD. And this is my systemic search. So the databases we used are Medline, Embase Central, and my search key. Okay, here's my key articles. So the population is adults with periodontitis and cardiovascular disease. And there was a prevalence in bacteria found in both samples from oral and cardiovascular region. And this is my flow chart. So we had 16,260 hits. After duplicate removal, we have 12,848, and we're still working on it. So we're working on title abstract selection. And my second topic is to investigate the effect of endodontic treatment on inflammatory biomarkers. It's a systematic review and meta-analysis. An endodontic infection affects up to 87% of the population worldwide. Endodontic infections may perpetuate systemic inflammation and increase inflammatory markers such as high-sensitivity C-reactive protein, tumor necrosis factor alpha, interleukin-6. So an elevated high-sensitivity C-reactive protein can predict the likelihood of developing cardiovascular disease. So if we leave an endodontic infection untreated, it may potentiate the progression of cardiovascular disease. And our aim is to determine the level of inflammatory biomarkers in serum before and after endodontic treatment. Our clinical question: how does endodontic treatment affect levels of inflammatory biomarkers in adults? Our population, adults with endodontic disease, we take a blood sample before and after endodontic treatment, and we check high-sensitivity C-reactive protein, interleukin-6, and tumor necrosis factor alpha. And our hypothesis is that root canal treatment can effectively reduce the levels of inflammatory biomarkers. Our clinical implication is to increase the awareness of the role of the dentist in the prevention of comorbidities. And this is my search key. We searched 3 databases, and all of my key articles showed a significant reduction in the levels of inflammatory biomarkers after endodontic treatment. Okay, this is my progress. We're checking the feasibility, and I plan to submit my first topic in May 2024 and my second in September 2024. Thank you for your attention. I would like to finish with a quote: "The art and science of asking questions is the source of all knowledge," by Thomas Berger. Thank you.
About the population of your study, you mentioned cardiovascular disease. Can you please specify what exactly diseases you will study? And second part of the question about the bacteria as well. Maybe more exact variants of the bacteria.
Yes.
Thank you.
Okay, so we're investigating cardiovascular lesions. It can be atherosclerotic plaque, aneurysmal wall, aortic stenosis, and we're looking at the location also. So it can be like coronary artery, carotid, and aorta, everything cardiovascular related, basically. And the profile of bacteria is periodontal pathogenic bacteria. So we're looking at if a patient has periodontitis, the possible role it could have in systemic diseases by traveling by bacteremia. And
I would like to ask on your first project, I think, you said that the outcome is going to be cytokines and CRP, right?
Yes, for the second project.
Second, okay. So maybe you have an answer for why specifically those biomarkers and not more biomarkers?
Yes, well, high sensitivity C-reactive protein is very specific for the prediction of cardiovascular disease, and as are the other inflammatory markers also that I mentioned. Yeah.
Thank you so much.
Thank you.
Will you consider different types of periodontitis, like necrotizing or juvenile periodontitis, or in general?
No, we're excluding those types. We're simply including patients without periodontitis and mild, moderate, severe periodontitis.